Today I'm talking about the influence of light on well-being and performance, and how that can affect the design of the built environment. So I've already been introduced very nicely by Professor Mohammed, so we can move past that part. Okay, so first of all, to give you some background knowledge, we have very high light exposures when we're outdoors in nature. So you can see the levels there for sunlight, and even when we're in full daylight, it's quite high levels, between 10,000 to 25,000 lux. But when we're indoors, we're often in far lower, experiencing far lower light intensities, and that can have a big impact on our health and also our workability and the likelihood of us having infections. So the presentation just now is going to be going through that. It's going to be talking about light exposures you get typically during the daytime, and also light exposures you get during the nighttime. Okay, so yeah, on we go. So sorry, back one. So depending on where you are around the world, the amount of sunlight you can get will vary. Also, in many areas, particularly those far away from the equator, you get very low levels of UV radiation, and also reductions in the violet and blue radiations we get through. So that is showing how it typically varies throughout the year in different locations. And what we have to think when we're designing cities is how we can actually optimize these exposures, both the exposures we receive when we're indoors and the ones that we receive from the outdoors throughout the full 24-hour day. Okay, so the amounts of light we receive indoors varies on a number of factors, one of them being how far away we are from windows. It also depends the orientation of the room that you're in as well. So you have far more sunlight generally, depending which side of the equator you're on. You'll have far more sunlight on the south side compared to the north side, etc. And we have to take these kinds of things into account if we're wanting to help people to optimize their biological functioning and also their productivity and stress levels. So we're looking into this. So this is just giving a very brief overview, light exposures and performance. It's been shown that if you have good daylight in buildings, you've got better mental functioning, you've got better memory retention, better task performance. You can do your job better. It's also been shown that if you're able to get good exposures of daylight during the daytime, it can help you sleep better at night. So basically makes the body have a stronger link with natural circadian rhythms, and you can sleep better. Typically, it's around about 46 minutes extra sleep you can get just based on when you're working or where you're staying, the light levels you get. Also, it's been shown it can have a big effect on the efficiency and error rate within buildings. So as you can see with the information I put up there, if you have higher light levels, in this case for prescription dispensing, and in hospitals you had far lower error rates of the light levels that were going towards what you'd experience outdoor in shade. Okay, moving on. So also another important thing is light levels can really influence literacy. And this is incredibly important because the easier it is for people to learn, the higher level of jobs that they can go for, and also the more they're able to go and contribute to communities. So it helps develop people's own personal lives, but it also helps develop the GDP of countries. So again, it's been shown that higher light levels than are normally advocated in building guidelines can do a lot of good. Okay, and also it has been shown that with regards to academic performance, if you have larger windows, you get faster progress. And also you have higher subjective well-being as well. So the individuals who are being taught are feeling less stress. their general levels of well-being improves. They have higher levels of motivation too. So these kind of things can be undertaken in high-tech ways. They can also, as you can see in the photograph, be undertaken in very low-tech ways. So it's trying to realize what and also promote what the ideal levels are for these kind of measures. Okay, so that's giving you a quick idea on how that can affect learning and productivity. Next, we're going into light exposures and health. So healing environments. For a long, long time, it has been known that sunlight and daylight can have big effects on health. So one of the people to go and advocate that very strongly in Victorian times, that was in the 19th century, was Florence Nightingale over in the UK, and she'd noticed from her work that it was both fresh air and daylight, preferably sunlight, that was needed to help patients recover. Now, we've moved on since then. Some of these lessons have been partially lost. They're now being brought into play one more time. This slide is really interesting to me because what it shows is the time of day that people get exposed to a good amount of daylight can have a really big impact on their health. So it's, as you can see there, you're having markedly shorter recovery times for patients if they're in southeast facing rooms. So those are the ones that are getting the sunlight first thing in the morning to basically help the body wake up and realize that it's daytime. So if they get sufficient daylight at that time of day, it can help the body work more efficiently. Also, it can help with regards to its immune system functioning. It can reduce the amount of medication that is required for pain. And also the agitation levels that people can have as well. So there's numerous benefits if we can bring such kinds of knowledge into the designs of our buildings, both for healthcare and also for preventative healthcare. So the design of the built environment where people are living, how can buildings give people good amounts of daylight first thing in the morning to help them function better? Okay, yeah, and as you can see there, reduced levels of fatigue have been noticed as well. And also during COVID, there was a lot of fatigue being reported. And one of the reasons I think behind that was people were spending a lot of time indoors and they weren't getting a high enough light level to actually kickstart the body into its ideal routine. Okay, other kinds of benefits. It's been shown that if you have good exposures to daylight, it can help reduce heart risks and also can help reduce the risks of operations of heart patients. So there we go. So you have full spectrum light that can help. This can be both artificial or natural. With natural, we have to take into account as well, in some areas of the world, we have the dip down of beneficial wavelengths and intensities that have to be countered. Okay, moving on. Also with Alzheimer's, which is a huge challenge to us just now in terms of public health and has a huge impact on the global economy. It's been shown that optimizing daylight exposures can have effectively greatly reduced the risks of dementia. And it's also been shown that reducing exposure to outdoor light at night, so that's light coming in through windows at nighttime, can also greatly help reduce the prevalence of Alzheimer's disease. So how we're designing the outdoor environment in urban areas can have a marked effect. Okay, depression, that's one of the world's top causes of ill health and disability. Good daylight during the day can, obviously during the day, can help address that, as can making sure that people are in as low a light intensity as possible when they're sleeping. So ideally under 5 lux. And the wavelengths of the light that they're exposed to as well also is a factor in the likelihood of the condition arising. So it's with this as well, and with many other conditions, it's trying to make sure that people have optimized conditions to daylight during the daytime, and then at nighttime, you're easing them into a natural sleep cycle, and you're trying to make sure that the areas where they sleep are as dark as possible. Okay, this is some really interesting research done with mice, CH3 mice, which are ones which are particularly cancer prone, and it was demonstrating how the type of light that they're exposed to could have a significant impact on their health. So you can see it ranging from the pink fluorescent through to more natural kinds of exposures, including the kinds of exposures we get when we're indoors, to specialist glazing that's allowing full spectrum light from outdoors to come in, and then an air curtain where you're getting completely unfiltered light, which is greatly extending the lifespan of the animals. And what we have to think is how the light wavelengths and intensities we get exposed to in the urban environment, both outdoors and indoors, can impact our own health, and how we can create healthier environments for people, both through passive measures and through innovative active measures. Okay, so now we go on to the flip side of that. So light at night. So light pollution is a growing problem. It is greatly expanding. One of the reasons for that is because of the luminaires themselves becoming far cheaper to run. So people are using them to a far greater extent. So this is showing examples of how light pollution has been expanding over time, taking it up as far as 2020. And as well as the increased levels of light pollution, you have the additional factor that you're getting increased levels of blue-white light being created, which is particularly harmful for health. Generally, you should be trying to be over on the warmer side of the visual spectrum. Okay, so we're talking about blue and rich white light. It's shown with that you're getting increased risk of prostate and breast cancers. Also, you can have the immune system functioning being compromised by being exposed to that late at night. So it's how we can reduce the amount of light that is going out, also how we can try and reduce the amount that is being reflected into buildings and elsewhere. Okay, so we can use that to create healthier urban environments. Also, we have depression and obesity being affected by light at night. So with depression risk, it's 5 lux or over. With obesity, it's over 3 lux. And one of the things is with the increased levels of light, it's basically fooling the body to think that the day's extended. So it's tricking the body's appetite. So it's wanting to eat more. Okay, so we can design the urban environments to help prevent that. And ideally, what we could do is we could see if we could create cities of stars. So we could use our lighting really effectively, and when it's actually needed and where it's actually needed. That's both coming on and off when it's actually required. So we get more of a chance to reestablish our connection with nature, be more energy efficient, and also grow urban areas in a way that is going to be more environmentally friendly and biologically friendly. Okay, so this is the final part of the lecture. So this is looking into how pathogen growth is affected by sunlight. So it's been known for a long, long time that sunlight can kill pathogens. So Downes and Blunt were the first people to actually discover this scientifically. And they found out that sunlight could have a sterilization effect, both when it passed through clear window glazing and either deep blue glass. And also it's been shown through violet glass as well, but microbial growth occurred with red glass, which would block the natural violet and blue light wavelengths completely, and also yellow glass, which blocked the violet and some blue light. So spoiler alert, the thing is, it's been shown that it's not just ultraviolet, as you can see from this, it's not just ultraviolet that goes and kills pathogens. It's actually the blue and violet part of the visible spectrum and part of the green part of the spectrum too. Okay, so what we have with many of our energy efficient glazing types is beneficial frequencies being cut off, or at least greatly reduced. So as you can see there, though the blue and violet parts of the spectrum can kill pathogens, depending on the glazing type you have, you can significantly go and reduce the levels of those which go and pass through the glazing. So the effectiveness of a natural light to act as a disinfectant is greatly reduced. Going back to what Florence Nightingale was saying with regards to the design of healthcare areas with lots of daylight coming in, she was a strong advocate for open windows whenever that could be done as well. So lots of natural light and also unfiltered daylight whenever possible. And we have to think how we can go and basically reinstate the light wavelengths that we've got or optimize them. That can be done with the type of glazing. It can also be done through the type of luminaires we have indoors and how they're able to react to the light spectra as it varies through the day. Okay, moving on. So again, some very old research. This is showing how anthrax could be, spores could be inactivated by sunlight exposure. And as you can see, the violet and the blue part of the spectrum are very good at doing that, but you're not getting that effect with the red or orange or infrared parts of the spectrum. So we have to really see about how we can take this information into the design of areas that people frequent. Also tuberculosis. So it's after COVID has started to become less prevalent, it has once again regained its spot as the world's top infectious killer disease. But good news, we know that sunlight can kill tubercle bacilli. So that's been known for a long while. So as you can see, Koch, he got his Nobel Prize for research in TB. And one of the things that he discovered was that the daylight was able to kill it, including daylight that was passing through normal untinted glazing. And this was something, as you can see what Bernheim was saying in 1908, tuberculosis is the disease of darkness. The best means of restricting tuberculosis and sanitary surveillance of cities, especially in the freest possible admission of sunlight. So it's how we can get more sunlight or replications of the beneficial parts of sunlight within buildings. We've got a potential risk of influenza becoming a pandemic now. So we've got history being able to help us on that. We've been able to see that there's been a strong correlation between solar UV levels and influenza mortalities. Also, it's been shown in far more recent research that was published in one of the Nature journals that visible light wavelengths can also inactivate influenza. So we get the right wavelengths in, we can help reduce the risks. And it is the same situation we have with COVID. So with SARS-CoV-2, we have it being very light sensitive, as you can see there with the diagram I prepared on the decay rates at different times of year, and we could actually supplement that with artificial light to help address this. And again, not just UV, we can think about visible light wavelengths being able to help. Okay. And this is showing how the dust in floors can also carry pathogens and how sunlight can greatly go and reduce that. So it's the areas that are nearest the windows are the ones that have the lowest pathogen counts. Okay. And this is showing the levels of light, light intensities that are currently advocated in healthcare situations. So those are well below the levels that we really need to go and help both the patients recover and the medical staff work more efficiently and kill the pathogens. Okay. And then almost finishing off here, this is some research from the 1940s showing, again, how the effects of daylight levels could influence the amounts of bacteria that could be detected. So in this case, it was during the Second World War, there was a brick wall very close to the ground floor windows that was blocking the light a lot. They had far higher concentrations The pathogens on the first floor wards, which had good levels of daylight, they didn't have that problem. And with regards to modern solutions, as well as when we were able to design buildings from scratch, you can also introduce sunlight deep into the building, such as you can see there with the use of fiber optic tubes. So one of the great things about that as well, the intensity of light varies during the day as well, which can help get the body in a natural rhythm, as well as having the natural color balance that changes during the day. And there are a variety of other architectural design measures that can help get sufficient daylight in to improve biological performance and improve pathogen kill. Okay, and that is it. Thank you ever so much.